Welcome. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's session is part of our Climate Change and Health series, a special collaboration among the Blum Center, the MGH Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go over a few items with you all. Please note that this session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been muted so we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Joining us today, we have Dr. Sue Ellen Brakey. Sue Ellen is Distinguished Teaching Associate Professor in the School of Nursing and Associate Director of the Center for Climate Change, Climate Justice, and Health at the MGH Institute of Health Professions in Charlestown. Her clinical background includes global health and critical care nursing. Dr. Brakey teaches in the Doctor of Nursing practice and accelerated BSN programs with a focus on ethics, evidence-based practice, and population health. Joining us today, we also have Dr. Barbara Bellinger. Barbara is a perioperative nurse and chair of the Perioperative Sustainability Committee. She is also a member of the MGH Center for Environment and Health Outreach, where healthcare waste reduction initiatives across the organization are addressed. Barbara is currently promoting an initiative in Blue Wrap Recycling. Her work to promote a nurse-led initiative for recycle received a Clinical Excellence Award at the ORN Global Surgical Conference and ORN Manager Conference in 2019. Her doctorate in nursing practice work focused on informing healthcare policy for recycling from a national perspective, which was presented at the 2022 AORN Global Surgical Conference. She has presented her work to promote sustainability in the clinical setting and at the MGH Institute of Health Professions and Cambridge Health Alliance. They join us today to give a talk on the extent of health consequences surrounding climate change. So please join me in welcoming them.
Thank you, Amy. And I'm just going to share my screen here. And you. And let me know if you can see that. Okay, thank you. So welcome and good afternoon. I am delighted to be here and have been working with Amy and Barbara, along with my colleague, Dr. Patrice Nicholas, who is the director of our Center for Climate Change, Climate Justice, and Health at the IHP, who was unable to join us today. But we have enjoyed this collaboration with the Blum Center so far. So today I'm going to give you a brief overview of the health consequences of climate change, which you may or may not be aware of, but it's something that we've been working on, trying to increase awareness both in the community setting as well as in the academic and clinical settings. It's something that clinicians are not as aware of as they should be. And as we go out and we kind of spread awareness, people are pretty surprised in terms of the extent to which climate change can impact health. So just to kind of get us on the same page around global warming, which we all know is the issue that's causing these climate impacts, we need radiant energy, and we need a certain amount of greenhouse gases to keep the Earth warm. But what has happened since pre-industrial times is that amount of greenhouse gas emissions has really precipitously increased, which is causing increased warming. So they sit in this picture, they sit in this area above the sun. This is where the greenhouse gases are located. And so the radiant energy comes down and it warms the planet, which is a good thing to a certain extent. And then when it pops back up, it forms an affinity with greenhouse gases. And this is just a most recent look at an overview of greenhouse gas emissions in the United States. And so carbon dioxide is the #1 emitter, but also important is methane, nitrous oxide, and fluorinated gases. So these come from industrialization, and methane comes from natural sources as well as agriculture. And so what's important to note is that even though carbon dioxide is the largest emitter, these other greenhouse gases have a longer shelf life, if you will. So they stay in the atmosphere longer and they contribute to warming. So they're just as significant, really, as carbon dioxide. And this is a picture that just shows you the major climate trends in the United States. However, I think that this is from 2016. I think even in the last, 5 to 7 years, people are becoming much more familiar with what the climate trends are, because we're seeing this almost every day on the news. This is being talked about much more when we look at the weather, when we look at the news. And so where we're located in the Northeast, I'm not sure where people on the call are located, we're seeing more intense storms, extreme precipitation, flooding, and certainly out west, we know they're having wildfires, they're having intense heat, drought, hurricanes in the north, as the southeast. And so this is important to note because where you live will determine to a certain extent what health impacts you're most likely to be at risk for. And this is the U.S. Centers for Disease Control and Prevention, or the CDC. They do have, if you're interested in information, have a great website that talks about climate change and health. And this schematic or infographic just really shows the relationship between the climate impacts, rising temperatures, more extreme weather, rising sea levels, and increases in greenhouse gas emissions, and how that's impacting the environment with air pollution, changes in vector ecology, increasing allergens, water, food supply, environmental degradation, extreme heat, extreme weather, and then how those then relate to health consequences, which we're going to talk a little bit more about in depth. And this is just, it's a busy slide, but it shows you, it's a slide that shows you the impacts, the largest greenhouse gas emitters. And you can see here, China is #1. And then you can also see, I can't move this thing out of the way, there we go. You can kind of see in what areas, like to what extent or what percentage of their greenhouse gas emissions fall into which sectors. And so if we look at the United States, we have electricity and heat, transportation, building. And you can also see that the top 10 emitters, if you look at this orange sphere, really comprise a large portion of total greenhouse gases. And this kind of illustrates the concept of climate justice or climate injustice, which is that, the top emitters, the people who contribute least to greenhouse gas emissions are often the ones who are more severely impacted, not only on a global level, but also on a national and regional level as well. So those with less money, with less infrastructure, with less community resilience or national resilience are hit the hardest. And then this also just shows you healthcare without harm is another really a cool organization if you're into learning more about this. But in terms of our global healthcare footprint, you can see that it kind of follows the same pattern as what's seen among different sectors. You know, electricity is first, operational emissions is second, et cetera, down the line here. And if the global healthcare sector were a country, it would be the 5th largest emitter globally. This is the United Nations Sustainable Development Goals, which were promulgated in 2015. And you can see goal number 13 is climate action. But when you look at the rest of these goals, no poverty, zero hunger, good health and well-being, gender equality, and right down the list, there's really, in each of these, there's a little bit of climate related, they're very interrelated with the climate goal. And you'll see that a little bit as we talk further. So the air quality, the health impacts that we're going to touch on here briefly include air quality impacts, extreme weather events, vector-borne diseases, water-related diseases, food safety, nutrition, and distribution, impacts on fetal and maternal outcomes, pregnancy outcomes, and mental health and well-being. And so it's important to note that people and communities have differing levels of exposure, sensitivity, and adaptive capacity to respond. And so when we think about exposure, we're thinking about the contact between a person and one or more biological, psychosocial, chemical, or physical stressors, including stressors related to climate change. Sensitivity is defined as the degree to which people or communities are affected either adversely or beneficially by climate variability and change. So for instance, there are places because of changes in weather where their growing seasons are longer. And so there is a potential to take advantage of that given the degree to which that community might be resilient and have the resources to do that. And then adaptive capacity is the ability of communities, institutions, or people to adjust to potential hazards and to take advantage of opportunities or to respond to consequences. And again, that's kind of looking at the resilience of individuals and communities and what kind of resources do they have to build their infrastructure. And I think there have been a lot of examples of this that we have seen in the United States. If you look at Hurricane Katrina, going back to Hurricane Katrina, those areas where the infrastructure was not as robust suffered the most. And similarly with Hurricane Maria and the many hurricanes that have, Hurricane Sandy, the extreme weather events that have followed, we've seen those patterns. And so the ability to be able to address exposure or protect from it, be sensitive to climate impacts, and be able to adapt leads to the level of one's vulnerability, and then how that will impact their health. So what populations are most at risk for climate change related health impacts? And the populations include those who are socioeconomically disadvantaged, certain communities of color, including indigenous populations, very old, very young and the very old, women and pregnant people, indigenous populations I mentioned, those living with chronic physical or mental conditions or disabilities, non-English speakers, and non-US citizens. And it should be noted that climate change is an environmental justice issue that exacerbates existing racial disparities across a range of outcomes. And this is a great paper by Barbarian that was published in 2022, looking at racial inequities in climate change. And what they really showed, this was a systematic review, they really identified that for the most part, communities of color, there are disparities in how people, health related to climate change across communities of color, but those are not equal. So for instance, depending on the region where one lives, there might be different health impacts, and that infants, children, adults, and pregnant people, there are also racial disparities among those groups as well. So for instance, I think it was in the South, Black children were more, Black infants were more, were several times, the rates of sudden infant death syndrome among Black children as compared to whites was, several points or percentage points higher. That's one example. But it depends on the region and the population. So this is just an interesting article that was published by the Center for Public Integrity and Columbia Journalism Investigations, where they compared Arizona and Florida. So Arizona is a very dry, hot state, and Florida is a very humid and hot state, so has a higher heat index. And what they found was that there were higher rates of heat-related illness, ER visits, and hospitalizations in lower income areas in both of those states, and that the highest rates were in neighborhoods with a history of racial segregating and redlining. And these slides will be available, but that is the link to the article. So really kind of just shows kind of like the historical context surrounding some of these environmental and climate injustices. And then another example I just wanted to point out, because this was a documentary, Cooked: Survival by Zip Code, which used to be free on, on the public broadcasting, PBS, but I don't think it's available there anymore. I think you can get it on Amazon if you have a prescription. But this documentary was put out a couple of years ago, and it's really fascinating. It's about an hour long, and it did kind of a deep dive into the 1995 Chicago heat wave, where there were 739 heat-related deaths. They were mostly older, poor Black residents living in historically redlined areas. And number one, I didn't know anything about this heat wave at the time or since until I saw this documentary. But for 3 to 4 days, the heat index reached 125 degrees, and there were more affluent communities surrounding this particular community, or the two areas where most deaths occurred, where there were no deaths at all. And the documentary really points out it lays this out in a pretty stark way, that we put a lot of time and effort and resources into disaster preparedness and management, but we don't put the same amount of resources into preventing some of these issues. And this is really, 1995 was really before the mainstream was even talking about climate change impacts. And since this time, mortality in older people related to heat-related illness has actually almost doubled. So in terms of air quality impacts, I like this slide because it shows you when we talk about particulate matter, or sometimes what's referred to as PM 2.5 or PM 10, these are very, 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 very small particles that exist in the air. And so PM 2.5 is a result of combustion, organic compounds, and also, wildfire smoke when we have these big wildfires. PM 10 is a little bit bigger. So we're talking dust, pollen, mold. And then you can compare the size of these two PM 2.5 and PM 10 compared to something that we're more familiar with, like a human hair or a piece of sand. And so then you can see just how small these particles are. And so what happens is they have the ability to get into our lungs without our kind of protective mechanisms being activated, coughing and whatnot. But what happens is they get deep into our lungs, and then they can set off an inflammatory response. So this leads then to more exacerbations of asthma, newer cases of asthma and other respiratory diseases. And when you couple particulate matter and air pollution with heat, that is even more dangerous for people, and it can result in stroke, increases in MI and other cardiovascular diseases. And so it's important to note that these are things that we might not even know are contributing to cardiovascular and neurological or, cerebral vascular diseases or respiratory diseases, because they're very insidious, but they are impacting health. The most common and preventable climate impact on health is heat-related morbidity and mortality. So heat-related illness is preventable, but we haven't done a good job of preventing that, mostly through education and awareness of not only patients, but I think health providers as well. So this is a picture of an urban heat island. I'm not sure if people are familiar with this, but this is showing how for those people who live in urban areas where there's maybe less tree canopy and green space, the temperatures are higher, and not only during the day, but also at night. So there's like kind of a residual high temperature that occurs at night. So people who live in urban areas, and particularly those urban areas that have perhaps been disinvested in historically, where there's been racial segregation historically, and lack green space, those people are more related, they're more susceptible to heat-related illness and mortality and morbidity. They're also more susceptible to issues around mental health, aggression, and there is a causal link between heat and aggression. And so that's something to consider. And so you've probably seen there are large efforts and attempts to be increasing green space in urban areas. But really, there's really some cool work being done looking at specifically targeting those disinvested areas in certain cities, like work is being done in Philadelphia, for instance, to really increase the green space, particularly in those areas that need it the most. And then this is just showing you, I think if you live in the Northeast, you're probably familiar with the heat index, but just to kind of show you, if you have kind of just like a dry temperature with low relative humidity, then it basically feels pretty close to what the actual temperature is. So your body kind of perceives that heat in kind of its close to real form. But when you increase humidity, let's say it's an 88-degree day, but there's 70% humidity, you can see that your body then it feels to your body like it's 100 degrees. I think that's where I was at. Yeah, 100 degrees. So as we have more days over 90, which we are increasing in this area for sure. So as those high degree days increase in the face of higher humidity, then you can see the temperature, or the perceived temperature, really starts to get into the danger zone. And so that's really something to consider. We as health providers, we need to be considering that more, have more of a focus on that, but also as community members, people need to be aware of that as well, and thinking about, How do you prepare for hot days? Do you have elderly parents or young children who might be, going to playing sports, or making sure you're keeping people in during the hottest time of the day. Making sure if you have socially isolated family members or neighbors that you're checking in on them. If you're on medications, that you're talking to your physicians and your healthcare providers about what to do around that. So as I mentioned, this is from the 2020 US policy brief of the Lancet Countdown on Health and Climate Change, which the Lancet paper comes out every year, and it gives us kind of a report card of how things are going in terms of health and climate change. And then the United States creates a policy brief where they look specifically at what's going on in the United States. And so in 2019, people over 65 experienced 102 plus million more days of heat wave exposure than when compared to 1986 to 2005. And as I mentioned, heat-related mortality has almost doubled in the last 20 years. And so remember, I mentioned that is preventable with the right interventions and education. Occupational exposure is also really important to understand. So for people who are working outside, construction, people in the agricultural industry, manufacturing, service, this is important to think about for the military, firemen, picture people who have to wear really heavy gear, that they're impacted by occupational exposure as well. And it's also important to note for those people who may be non-US citizens and may be working in areas like, for instance, agricultural workers, if they're not enjoying the protections from, the Occupational Safety and Health Administration, OSHA protections, which have in place protections where people who are working outside have to have breaks, they have to have water breaks, they should be starting their days earlier and ending, before the high heat sets in. These people are prone to health impacts as well, and there's a syndrome called Mesoamerican nephropathy, where providers are seeing younger and younger people, and I'm talking about like in their 20s, who are developing chronic renal disease and requiring dialysis because they are being exposed to high heat without the protections of shade and hydration. In terms of vector-borne diseases, I think we all know, about Lyme disease. So there's longer seasonal activity in terms of tick exposure. I mean, I just took a couple of ticks off my dog a couple of weeks ago, and we're almost into December. There's increase in mosquito-borne disease because of increases in temperature, more precipitation. So think about like standing water in particular and how that can breed mosquitoes. And there's also emerging vector or re-emerging and emerging vector-borne diseases. So, things that we wouldn't expect to see in the United States. And you can remember, it's been a while back now, but there were concerns around Zika and pregnant women down in the southern states, which was very unusual. And this picture just shows you how Lyme disease, how it has expanded in terms of its distribution and also intensified. And I realize these are not the same scale, but you can see in 2001, it was a little bit more concentrated in the Northeast. And then you can see that has expanded to the West and has also become a little bit more intense as it has expanded. And I think this is just one example, but we all know the importance, well, we should all know, whether we do it or not, we know the importance of protecting ourselves and our pets, by the way, from Lyme disease and other vector-borne diseases in the Northeast. Again, I'm not sure where people are calling in from, but West Nile virus is another example of something that we are susceptible to. And then this slide kind of just basically tells the largest story about water-related diseases. And so if you look here, we know that the oceans are warming, and this sets up a situation where we can see these large algal blooms forming more frequently. And many of those are toxic. They have neurotoxins in them, and they can be dangerous to both humans and pets. And I mentioned pets because a few years ago, just in a suburb outside of Boston, in Arlington, there were dogs that were dying because people were allowing them to go into the lake, and these unaware that there were harmful algal blooms that were growing. And so that was impacting us locally in this area. What is also happening is that as the ocean is warming, and the ocean is a carbon sink, so it's also absorbing carbon dioxide. It's changing the environment of the ocean. And so there are things which have grown in certain areas which are not growing anymore. It can change. So for instance, I think in New York, they're seeing less oyster growth. I'm not sure that's the right word, but production because of the changes in the structure of the sea. And then with these like heavy rainfalls we're having, this is leading to runoff, farm and livestock runoff from water treatment plants, or if water treatment plants go down during extreme weather events. And so this is contaminating the water, leading to contaminated food and sickness like E. coli. We see a lot of that. So these are all kind of examples of how climate change is impacting us in terms of water-related diseases. And then one, perhaps this might be the greatest concern globally, is the idea of malnutrition. So both obesity and undernutrition people are at risk for because of climate-related impacts. So a few things are happening here. So one is the actual the nutritional makeup of food is changing because of carbon dioxide and other, greenhouse gases, but carbon dioxide mainly. And so some foods are actually less nutritious because of the changes in the growing season and because of carbon dioxide. Other issues related to malnutrition, there are island nations that are unable to independently resource their citizens in terms of food. And so they're reliant on foods that are being shipped in from other places. And an example of this is the Marshall Islands, where because they have rising sea levels, they're heavily reliant on others for food. And so some of the food that gets shipped in to places like this are really unhealthy. So like spam and other processed foods, which then lead to, non-communicable diseases like, cardiac disease and diabetes and obesity. And this is because they're really not able to sustain their own food production. And what the Lancet called this interrelationship between climate change, obesity, and undernutrition, so that these people who might be developing obesity because of they're eating these high calorie foods that don't have a lot of nourishment, they're undernourished, there's obesity and related to climate change. And they call this the global syndemic. So really the synergy of these three pandemics, which together are worse than each alone may be. And then in terms of mental health, this is becoming more and more, people are understanding more and more how this is really just cuts across all of these issues that we've talked about already. But eco-anxiety, you may have heard of, which is just anxiety with kind of watching the destruction of the environment. Eco-grief kind of takes that a step further. To the grief people can feel around that. Solastalgia, which is a feeling of desolation related to the loss of one's environment, particularly for those who really feel a deep relationship with the environment in which they live. And so think, for instance, about Indigenous people. And there's a great quote by an Inuit community member that says, we are the people of sea ice. How can we be the people of sea ice if there is no more sea ice? Which really kind of, it's very poignant and kind of to the point. But we're also, you know, seeing this with people who are losing their houses in these big fires or have to relocate because of hurricanes, etc. And the more we see these natural disasters, the more we're going to see these mental health impacts. So post-traumatic stress, anxiety and depression. I mentioned the relationship between aggression and heat. And then understanding that chronic stress then can lead to physical impacts. You know, compounded stress impacts your immune system. It impacts, you know, your blood pressure. And so this can lead to more physical illness, such as cardiac disease, etc. And then suicide ideation and suicidality. And this is big. This is a big issue in farmers globally, where people who lose their livelihood are at risk for suicidality. My colleague, Patrice Nicholas, who I mentioned earlier, and I were invited to speak at an art gallery in Stowe, Vermont called The Current. And they had an art installation which was all about the impacts of climate change. And one of them, which I thought was really interesting, was around, it was a video of a daughter who was talking about her dad's suicide after Hurricane Maria. And so while it's talked a lot about in terms of people who, farmers and its relationship to drought, it can also be related to natural disasters and extreme weather events, etc. And so what do young people think? Because they're, you know, the people who are really at risk for mental health impacts include those populations we talked about. But the young people are really, you know, they're going to stick around longer than older generations. And there's this, you know, I think a lot of, particularly with like Greta Thunberg, you know, there's this idea like that they're going to kind of come in and maybe make things right, but that's a lot of stress to put on the younger generation. But there was a study of 10,000 young people that was done. This was an international, both global north, global south. 60% felt very or extremely worried about climate change. Greater than 45% indicated that these feelings impacted their daily lives, and 77% indicated the future is frightening. And there have been other studies where young people feel like a large number of young people feel like the world will end in their lifetime. So there was a study also done, this was just published recently, where this came out of Yale, and they wanted to see how do children and teens manage ecological grief and eco-anxiety and leverage it for action. And then they also wanted to know what are the dynamics between adults and minors around the climate crisis. And they looked at newspaper articles, and they did a discourse analysis. You know, they analyzed the language of these newspaper articles. And what they found is that articles about mental health impacts increased after 2020, which kind of makes a little bit of sense given the pandemic as well. and that there was an increased number of reports about youth protests after 2018. And I love this picture. This is a picture from a climate protest from a few years ago. And, you know, I'm sure you're familiar with this, like kids leave school and they go out and they march for climate, you know, usually in the spring of every year. But what they found in this analysis of these newspapers, they identified different themes in terms of the youth and then the parents and adults. So the adults didn't necessarily have to be parents. And they found that there's a group of people who are identified as fierce young activists, you know, very emboldened. They want to get out there. They want to organize to make change. There are adultified children who are taking responsibility for both youths and grown-ups, that they're innocent victims at the mercy of climate change. And this is really interesting because another study talked about kids being like, they described it as moral injury, like young adults who are not old enough to actually vote to make legislative change, having a lot of anger and just moral distress around the fact that we as adults haven't made the changes that we need to make, which I think was really interesting. And then also characterized in the newspapers as ultimate saviors of humanity, an unsolicited burden on small shoulders, which I think is also interesting when we think about how sometimes we look to the youth to look at this problem. And then parents is just kind of, you know, trying to manage their children's eco-anxiety. There's some criticism around youth-led activism. And then also just a feeling, some people a feeling of transcendence and kind of trying to reimagine how we can, through climate action, change the world. So kind of a range of categories there, but just I thought it was a really interesting study to look at what is actually in the lay press. And then really, really briefly, I wanted to show you that the Yale program on climate change and communication collaborate with the Center for Climate Change Communication at George Mason University. And they put out these surveys to Americans. And I don't think there have been any more specifically around the 6 Americas since 2020, but I could be wrong about that. I couldn't find a more recent one. They've actually moved on to other questions, but what you can see here, the 5-year trend, they have 6 Americas. They have people who are alarmed, who are taking action, people who are concerned, they believe this is happening, but they haven't quite gotten to the point where they've taken action. Those who are cautious, disengaged, doubtful, and dismissive. And so you can see from 2015 to 2020, the number of people who are alarmed has increased, 15%. And there has been a decrease in each of the categories, with most of the shift maybe going down into the alarmed. And again, I think this is related to the fact that we're seeing this much more in the press. We're seeing this when we watch the news at night, you know, meteorologists are talking about these things. And so then I just included here a few important reports. The first one is this report. This is the second revised edition, Mental Health Impacts in Our Changing Climate, Impacts, Inequities, and Responses, which is a really good overview of mental health impacts related to climate change. The Romanello article is the most recent, actually it's not the most recent, but it is the second most recent report of, and then the Intergovernmental Panel on Climate Change. This is the most recent report that they have put out. And then these are some websites, and few websites if you haven't seen them or you wanted to explore more. I said my internet was unstable, but if these are just things, if you wanted to explore more, would be helpful. And on that note, that's just kind of a brief overview of things.
Thank you so much, Sue Ellen. We are now towards the end of the session, so if you have any questions for Sue Ellen, please enter them in the chat. As we approach colder months, what climate change impacts should we be thinking about or preparing for in the New England area?
So, well, one of the things that I mentioned was, you know, as we're getting to colder months, there's really kind of a shift. I mean, look at November, how warm it's been. So first, I would say kind of be thinking about the things that we do in the summer, especially related to like ticks, for instance, and Lyme disease. And then there are, and we've seen this too, there are also extreme cold events that have occurred. Like I think, was it last year in Texas with the freezing? Was that last year? My COVID clock is, you know, never quite right. And so we can see extremes of cold, but what they're saying, what the science is saying is that those extremes of cold, the heat extremes will essentially outweigh the extremes of cold. But I think there's always one of the things that I think people can do as individuals, and I need to take my own advice, is to really kind of prepare for, to have like a little emergency preparedness kit ready. There's plenty of ways you can do that. You can Google it. But we know that even in the cold, you know, there's high winds, we can lose power. So just making sure you have those things that you would need in an emergency if you were unable to kind of leave your house, or if the phone lines go down, like water, flashlights, batteries. If you're on medication, maybe some extra medication. But there's plenty of websites that can kind of, and also like Massachusetts government websites that can really help you put that together.
Thank you. What is Mass General doing to address these climate change and health concerns?
So, so I am a faculty member at the MGH Institute of Health Professions, which is the academic arm of the Mass General Brigham system. But and we at the IHP and our Center for Climate Change, Climate Justice and Health have collaborated with the Center for Environment and Health, of which Barbara is a member, and most recently with Brigham and Women's Hospital. So one thing we do is we're doing a lot around raising awareness. We have monthly webinars that talk both about health impacts of climate change, but also issues around environmental sustainability. The center has had a symposium now. This is going to be either our 4th or our 5th symposium, and we're now partnering with the Center for Environment and Health to put that on this year. So then that's kind of more of that's awareness raising of clinicians, students, community members. But I know that, and Barbara, maybe you can speak to this better. Like, I know that the Mass General in particular has 4 pillars for their Center for Environment and Health. One of those is climate change and health, but I know others are related to sustainability.
Yes, it is. On the Center for Environment and Health website, all of that information is accessible to anyone who wants to look it up and participate or donate and join. And it's a great opportunity for learning, just a lot as well as what we are doing right here in the series, the climate change series. I don't know all of it by heart, but a lot of it is all to help reduce all of the impacts on greenhouse gas emissions and what we can do to promote healthier healthier environments within our communities. It's a great resource.
Thank you. You had mentioned earlier it's great how the youth are becoming involved in addressing this climate crisis. For those who are new and want to get started, where can they go? How can they start?
Well, they can look for a climate protest in their area. I think there are existing organizations that are not youth related, like the Planetary Health Alliance, Eco America. They can, get school groups together. I have a colleague of mine has a teenager, and she is the one in the family that is like taking the lead in making sure that they're more sustainable. So I think kids should maybe reach out to their classmates, their teachers, look for local organizations that they can get involved with, because even if they're local organizations, it doesn't mean just because they're kids, they can't be part of that.
Thank you. And so I think we have a couple more questions, which I'm going to turn it over to Barbara.
All right, thank you. So Ellen, it was a great presentation. Thank you. I was really concerned about two things. One was I had no idea about the toxicity from the algal bloom. That was really concerning. I have a dog and I walk him a lot, and I've never stopped letting him explore. But I guess the only way to actually address that, as from what you say, is to really just keep them away from it. Is that correct?
Yeah, I mean, I think it's up to really like local governments and towns to be, from what I know, that I don't let my dog go into water if it looks green or red. And I also probably didn't say this, but it can be damaging to human health. So if people are eating shellfish that have been harvested from an area where there are harmful, or sometimes they're called HABs, then that can actually be serious for humans too. So it's really, I think it needs to get regulated at a state or town level, as well. But I guess to answer your question, when in doubt, keep them out.
Keep them out, yeah. That's so true too. The other thing was also your information on particulate matter, and the impact of that on cardiac health, and how that really should be communicated to an awful lot of individuals within the community. Is most of it, is any of it aggravated by the climate change from the environment? Or is it mostly organic?
It's both. So if you think about it, and by the way, I also didn't mention another really serious impact is for pregnant women. So air pollution and heat, particularly in those disinvested areas, can lead to intrauterine growth restriction, preterm labor, some congenital anomalies. And so it's important to think about, like, the example I think of is the Tobin Bridge, which is, the largest bridge in the region. It sees about 80,000 cars a day. So it's creating, air pollution from combustion. And then when it's really high heat days, that's also going to impact, those things together are going to impact health. But if you think about particulate matter from, air conditioners. So we need more air condition, like if the hotter the days get, then you need more air conditioning. So that's going to contribute to particulate matter. And then if you think about these wildfires and the smoke, they've actually found black soot in the placenta of pregnant women, for example. So, and smoke, wildfire smoke can travel for thousands and thousands of miles. So it's important to think about the different kinds of particulate matter and air pollution, and then also its compounding effects with heat.
Thank you. I didn't know that either. Thank you. Are we about done?
So we're about time. Thank you so much, Sue Ellen. Thank you so much, Barbara, for joining us today. As I had mentioned, today's session is being recorded. So if you're interested in being recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. And you'll also see in the chat that I provided a couple of resources to the Lancet as well as the MGH Center for the Environment and Health that we hope you find helpful. All right, so I think that's a wrap. Thank you so much for joining us today. Have a lovely rest of the day.
Thanks.
Thank you.